May I come in?
Yes.
Hi, my name is Sasha. I'm going to be your student nurse today. Can you give me your name and date of birth?
Jane Smith, August 5th, 1965.
All right, nice to meet you, Jane. So today I'm going to be showing you how to perform some hand hygiene before and after you empty your colostomy bag, okay?
Okay.
And we're doing this just to prevent infection so that you don't come back into the hospital, because you got sick from not proper care of your colostomy, okay?
Okay.
So the first thing I'm going to do is going to show you how to perform hand hygiene. So if you just want to watch me, and I'll talk you through it as well, and then I want you to show me how to do it. So I'm going to just turn the water on. So the water usually has to be about 105 degrees, so pretty hot. And then you just want to wet your hands, get some soap, and then you just want to wash your hands for about 15 to 20 seconds. So usually the length of the happy birthday song or singing your ABCs twice is a good length of time. And you want to get in between your nails, in between your fingers, up to about your wrist. And then you want to dry and wash down. And then you want to just grab some paper towel. And you want to dry your hands. And then you want to grab another piece of paper towel and turn off the sink. Is that simple enough for you, Jane?
Yes.
Okay, do you feel comfortable trying it?
Okay.
Okay.
So what I'm going to want to do is turn on the water, let it get to 105 degrees, wet my hands a little bit, get some soap, make sure I'm washing in between the fingernails and on my wrist and on the palms for about 30 seconds, singing the happy birthday song or the ABC twice. Then I'm going to wash my hands again, grab a paper towel, and then grab an extra paper towel to turn off the sink.
All right, Jane, how did you feel doing that?
Comfortable.
Okay, that's good. So then now, Jane, the next thing we're going to do, we're going to empty out your colostomy bag. So I have a graduated cylinder for you. I'm just going to grab us both some gloves. Okay. So, sometimes it can be easier if you're standing up or you're sitting down. It's more of what you're comfortable with, okay? So, are you okay with me exposing your colostomy bag?
Yes.
Okay. And then if you can just hold that. Okay. And then you just want to keep the graduated cylinder underneath the clasp. And then you pour it in. Okay. And then once it's all empty, you just close it up. And then you just want to dump it into the toilet. So, Jane, as of right now, you're not going to be having any formed stools, like formed feces inside of your colostomy bag because it's still pretty new. So the feces that are going to be coming out, they're going to be a little bit watery and a little bit tar and black. But once your colostomy's been around for a little bit longer, like maybe about a few weeks or so, you'll start getting those formed stools. And if you haven't seen any formed stools in about a few weeks, you need to make sure you contact your primary care provider so that they can come and see what that is, what's going on, okay?
Okay.
So do you feel comfortable showing me how to empty your colostomy bag?
Yes.
Okay.
Do I put hand sanitizer on or after I'm done?
Well, you did just wash your hands, so you could just put the gloves on. But when you are at home, I want to make sure that you should sanitize your hands before and after you empty your colostomy bag. And you definitely want to make sure you're washing your hands with soap and water when you're going to change your colostomy bag.
I forgot to grab my graduated cylinder before I did the class. So I'm going to undo the clasp, hold it underneath, let it drain, and then as soon as it's done draining, I'm going to put it in the toilet and flush it. And then immediately dispose of the gloves and wash my cylinder with hot water.
Yeah, you can wash it with hot water, or you can just use some Clorox wipes. Whatever you feel comfortable with at doing at home is what works best. But we do want to prevent infection. So yeah, hot water and soap would work fine. And then you just want to perform some hand hygiene again if you have hand sanitizer or hand soap. Do you have any questions for me, Jane?
No, that's it. Thank you.
You're welcome. You have a good day.
Thanks, you too.
And your call bell is right there.